talking about nutrition's role in bone health. I'll be discussing how proper dietary and life choices are essential for preventing bone diseases such as osteoporosis. A good diet is essential for maintaining healthy bones and preventing conditions like osteoporosis. Nutrient-rich foods provide the minerals and vitamins necessary for bone strength and density. Key nutrients such as calcium and vitamin D are vital. Calcium builds and maintains bone structure, while vitamin D ensures that calcium is effectively absorbed by the body. Additionally, a diet high in protein supports bone health, and other nutrients like magnesium and vitamin K contribute to bone formation and repair. Consuming a variety of fruits, vegetables, and whole grains not only provides these essential nutrients, but also offers antioxidants that can help protect bone cells. By prioritizing a balanced diet, individuals can support their bone health throughout their lives, reducing the risk of fractures and other bone-related issues. Osteoporosis is a medical condition characterized by a significant decrease in bone density and strength, which can lead to an increased risk of fractures. The term osteoporosis literally means porous bones, as the disease causes bones to become weak and fragile. This deterioration often occurs without noticeable symptoms until a fracture happens, making it a silent yet serious health issue. The risk of developing osteoporosis increases significantly with age, particularly after the age of 50. Women, especially postmenopausal women, are more commonly affected, with about 1 in 2 women and 1 in 4 men aged 50 or older experiencing a fracture related to osteoporosis. These statistics highlight the urgency of addressing osteoporosis as a public health concern through effective prevention, early diagnosis, and treatment strategies. Osteoporosis is a significant global health issue affecting millions of individuals worldwide. According to the International Osteoporosis Foundation, approximately 200 million people are estimated to suffer from osteoporosis globally. This condition leads to an estimated 8.9 million fractures each year, translating to 1 osteoporotic fracture every 3 seconds. These fractures primarily affect the hip, spine, and wrist, leading to considerable morbidity, mortality, and healthcare costs. In the United States alone, about 54 million people either have osteoporosis or are at high risk due to low bone density. Initially, osteoporosis was seen as an inevitable part of aging, but research in the mid-20th century identified it as a preventable and treatable condition linked to bone density loss. As nutritional science advanced, the role of calcium and vitamin D in maintaining bone health became clearer, leading to recommendations for increased intake of these nutrients. Magnesium, phosphorus, and vitamin K2 were identified as important minerals for maintaining bone density and preventing osteoporosis. Guidelines for osteoporosis prevention and treatment have shifted over time, focusing on early detection through bone density tests, lifestyle changes like regular exercise, and dietary adjustments. Bone density tests, like DEXA scans, measure the strength and density of your bones. These tests help detect osteoporosis early before a person experiences any fractures. Many experts support the use of calcium and vitamin D supplements to reduce the risk of fractures, especially in populations vulnerable to osteoporosis. Clinical trials have shown that supplementation can increase bone density and reduce the risk of fractures in older adults, particularly in postmenopausal women. Studies published in the Journal of Bone and Mineral Research found that calcium and vitamin D supplementation decreased fracture risk in individuals over 50 years old. As a result, various health organizations, such as the National Institute of Health and the Institute of Medicine, recommend specific daily intake of calcium and vitamin D to support bone health. Current guidelines suggest that adults over 50 should get 1,200 milligrams of calcium and 600 to 800 IU of vitamin D daily, either through diet or supplementation. Some researchers argue against the routine calcium and vitamin D supplementation. One concern is the potential risk of toxicity or side effects such as kidney stones associated with high doses of calcium supplements. An analysis in the British Medical Journal found that calcium supplementation alone had limited effects on reducing fractures and could even increase the risk of cardiovascular events in certain individuals. Many experts now suggest that getting calcium and vitamin D from whole foods such as dairy products, leafy greens, and fatty fish may be a safer and more effective way to maintain bone health. Dietary sources also offer other nutrients that contribute to overall health. It has been argued that dairy products are a key source of calcium, which is vital for bone development and maintenance. Dairy products such as milk, cheese, and yogurt are rich in calcium, vitamin D, and phosphorus, which are critical for bone health. The National Institute of Health suggests that adequate calcium intake during adolescence can lead to higher peak bone mass, thereby reducing the risk of osteoporosis later in life. Several nutrition organizations endorse the inclusion of dairy in the diet for optimal bone health. The American Academy of Pediatrics recommends that children and adolescents consume 3 servings of dairy per day to ensure adequate calcium intake. Drinks such as flavored milk and yogurt smoothies can make it easier for kids to get these nutrients in a tasty way. It's also helpful for parents to encourage healthy habits by enjoying dairy products themselves and teaching children about the benefits of strong bones. The Dietary Guidelines for Americans emphasizes dairy as an essential food group, underscoring its role in providing necessary nutrients for bone health. On the other hand, advocates of plant-based diets argue for the importance of non-dairy sources of calcium and other nutrients essential for bone health. Foods such as leafy greens, nuts, seeds, and fortified plant-based milk can provide adequate calcium and other micronutrients. Diverse diets, including various fruits, vegetables, and whole grains, contribute to optimal bone health. The study emphasizes that individuals who consume a balanced diet rich in these foods have better bone mineral density compared to those relying solely on dairy. Cultural and ethical considerations also play a significant role in dietary choices. Many individuals may choose plant-based diets for health, environmental, or ethical reasons. Research highlights the potential for plant-based diets to meet nutritional needs without animal products, emphasizing the importance of varied and balanced intake. Individuals following vegan diets can achieve sufficient calcium levels through careful dietary planning and supplementation. Cultural beliefs significantly impact dietary choices regarding dairy consumption. In some cultures, dairy products are considered staples and are widely accepted as essential sources of calcium and other nutrients. In Western cultures, milk and cheese are often integral to daily diets. In contrast, other cultures, such as some Asian and African communities, may have lactose intolerance prevalent among their populations, leading to limited dairy consumption. Some religions, such as Judaism, have certain dietary laws that restrict them from eating certain foods. Within the Jewish religion, they are only prohibited to eat foods that are kosher. Kosher dietary laws dictate what can be eaten, and while dairy is allowed, it must be consumed separately from meat. This practice may influence overall dietary patterns and calcium intake if not carefully managed. Socioeconomic status plays a crucial role in determining access to nutritious and calcium-rich foods, including dairy products. Families with lower income levels may have limited access to healthy food options, leading to dietary patterns that do not meet nutritional needs. Individuals in low-income neighborhoods often face food deserts, making it challenging to obtain fresh dairy products and other healthy foods. This lack of access can contribute to poorer bone health over time. The cost of dietary supplements compared to whole foods is an important economic factor influencing dietary choices. While calcium and vitamin D supplements can be an option for individuals who do not consume enough dairy or fortified foods, they can be expensive and may not be covered by insurance. Individuals may prefer whole food sources of nutrients due to cost considerations and the belief that whole foods are more beneficial than supplements. Promoting affordable, nutrient-rich whole foods is critical for ensuring better dietary habits among all socioeconomic groups. The economic burden of untreated osteoporosis is significant, impacting both individuals and healthcare systems. According to the National Osteoporosis Foundation, the direct medical costs associated with osteoporosis-related fractures in the United States are estimated to be over $19 billion annually. These costs highlight the need for preventative measures such as encouraging sufficient calcium and vitamin D intake from dietary sources to lower the chances of bone fractures and healthcare costs. Government funding is essential for osteoporosis research and preventative programs. Initiatives that support research on osteoporosis can lead to better understanding, prevention, and treatment strategies for the condition. The National Institute of Health and the Centers for Disease Control and Prevention provide funding for studies and public health initiatives aimed at improving bone health. Initiatives from organizations like the National Institute of Arthritis and Musculoskeletal and Skin Disease fund research projects aimed at understanding osteoporosis and improving prevention strategies. Additionally, policies that promote public education on bone health can help ensure that individuals have access to the information they need to make informed dietary choices and reduce their risk of developing osteoporosis. Increased funding for osteoporosis research can lead to more effective prevention strategies and better public health outcomes. Healthcare providers are essential in guiding patients toward making healthier dietary choices. They can educate patients about the importance of nutrition for bone health and recommend specific foods that contribute to optimal calcium and vitamin D intake. Research shows that effective communication from healthcare professionals can significantly impact patients' dietary habits. By discussing dietary needs, providing resources, and helping patients set achievable goals, healthcare providers can foster a culture of health awareness and promote better long-term outcomes for bone health. Public health campaigns play a vital role in raising awareness about the importance of bone health as well. The National Bone Health Campaign aims to educate the public on the significance of calcium and vitamin D in preventing osteoporosis and promoting strong bones. These campaigns often include community outreach programs, educational materials, and events that encourage individuals to make healthier dietary choices. By spreading knowledge and resources, public health campaigns can empower individuals to take proactive steps in maintaining their bone health. In conclusion, proper nutrition plays a key role in preventing osteoporosis and keeping bones strong. Getting enough calcium and vitamin D from food or supplements helps support bone density, while a balanced diet full of fruits, vegetables, and protein further strengthens bones. By combining a healthy diet with regular exercise and good lifestyle choices like avoiding smoking and limiting alcohol, we can significantly reduce the risk of osteoporosis and protect our bone health as we age. These are all my sources cited.